Glambitious. Glambitious Talk Show.
Hello everyone, I am Lily Mae and welcome to another episode of Glambitious Talk. If this is your first time tuned in, I encourage you to visit theglamceo.com to learn about the many things we have to advance your business. Now today, this is a special conversation. Dr. Lipman is no stranger to the Glambitious brand. You've seen him on our platform before. He's doing extremely important work as it relates to helping women with fibroids. So Dr. Lipman, just introduce yourself in case they are unfamiliar and they haven't heard of the work you do. Just tell us all about, your journey and the work that you're doing right now.
Well, I appreciate you having me. I am the founder and medical director of the Atlanta Fibroids Center. I've had the privilege of caring for women suffering with uterine fibroids for the past 30 years. We've seen women from all over Georgia, all over the Southeast, all over the country, and even other countries have come to the Atlanta Fibroids Center for our expertise. So we're known throughout. It's all I do. It's my life's work. All I do is care for women suffering with fibroids. We perform a procedure that's completely non-surgical and outpatient. It provides several important things. One, the women get the relief they're looking for. I mean, the success rate of this UFE procedure in my hands is well over 90%. So they get the relief, they avoid the long recovery, and they avoid the risks of surgery. That's important. And importantly, and often underappreciated, they get to keep all of their parts. I hear so often in the office, well, my doctor told me I didn't need my uterus anymore because I'm not interested in having children or any more children. That's absurd. Your uterus is really important to you, even if you're not interested in bearing children or more children. There's a lot of side effects for women suffering with a hysterectomy, and it's just unnecessary. So if you talk just in general terms, some statistics, fibroids are very common. Common in all women, but particularly common in women of color. At least 80% of adult African-American women have these benign fibroids. So they're common. Fortunately, they're not cancerous, they're benign tumors, but they can cause a lot of misery. It's the number one reason why women have heavy periods. Sometimes women bleed so heavily they don't realize it's not normal. We can talk about that, but it's the number one reason why women have heavy periods. Unfortunately, it's also the number one reason why women undergo hysterectomy. And these are young women. The average age of hysterectomy in this country is less than 40. And I've met way too many women, less than 30, have already had hysterectomy. I spoke at Tuskegee in front of several hundred young Black women. A number of them came up to me afterwards crying after I talked about UFE and how this non-surgical procedure could replace hysterectomy. They had already undergone hysterectomy under 30, and they were obviously very upset about this because doctors don't mention this. Even though this has been available, say I've been doing this 30 years now, it's available. The gynecologists know all about UFE, but they're all surgeons, and they elect not to tell you. Well, you're entitled to know all your options, not just the surgical ones, and UFE is one of the biggest medical breakthroughs for women. I'd put it up there in terms of significance to women with the pap smear and the mammogram. And here's a group of physicians, the gatekeepers of women's health, and that's why women don't know about it, because they've done a great job of keeping this on the down low. But you went into gynecology, I presume, to help women, and you don't mention it. I don't know how you sleep at night.
Yeah, and I've actually had friends who are suffering with fibroids. I've had friends who were, recommended to have a hysterectomy. And one of those friends, before she did that, I said, no, you have to meet Dr. Lipman. And she literally came from Charlotte, North Carolina to Atlanta to have her procedure and was very happy with the results. And she's, doing great. So it's very important for those of you tuned in that you check with your friends to see what they're dealing with medically so that you can share this as a resource to them, because unfortunately, so many people do not know. And that's what I did with my friend. And fortunately, she was able to, save her female organs and have like a seamless procedure that relieved a lot of those challenges that she was having. So if you can, maybe go through some of those challenges
Sure.
that women have with fibroids.
Well, we see lots of symptoms from fibroids. As I mentioned, it's the number one reason why women have heavy periods. So the three most common symptoms are heavy periods, pelvic pain, and increased urinary frequency and waking up at night. Fibroids, and a lot of these women can feel their own fibroids. It makes them look pregnant. That's a tough conversation, telling somebody congratulations only to find out they're not pregnant. So it enlarges their uterus like a pregnant woman, and these fibroid tumors are hard as rock, and so they sometimes can feel them. That's how they cause their symptoms. They press on whatever's next to them. So the fibroids that are located underneath the lining near the center of the uterus, near the uterine cavity, those are the ones that cause the heavy bleeding, the so-called submucosal fibroids. There are ones on the outer surface of the uterus, away from the cavity, away from the lining. They cause bulk-related symptoms. So they'll press on pelvic nerves to cause pain, either in the pelvic region, or it can radiate into the low back, hips, or legs at all. Just like the sciatica that somebody gets from throwing out their back, if the fibroid is located in the back of the uterus, it'll press on those same pelvic nerves. Fibroids that live in the front of the uterus will press on what's right next to the uterus in front is the bladder. And so imagine a rock hard like paperweight on the bladder, compressing it, and so the bladder can't fill appropriately, so the woman has to go more often and wake up at night to urinate. So depending on where these fibroids are located, if they're located near the lining, heavy bleeding. If they're located in the suburbs, in the outer part of the uterus, bulk-related symptoms. The most common type are called intramural. They're in the muscle, which makes up 95% of the uterus. The intramural fibroids, depending on which way they grow, will determine symptoms. If they grow inwardly toward the cavity, they'll cause more bleeding. If they grow outwardly, they'll cause more bulk-related symptoms. Or if they grow in both directions, they'll do both. And one of the nice visuals that I saw recently was from Lupita Nyong'o, the actress who is struggling with fibroids currently. She described her fibroids as fruit. So she has small fibroids that are like cherries. She has middle-sized ones like lemons, oranges, even grapefruits, or bigger than grapefruit. So she's got a whole fruit salad going, and she struggled with fibroids back in around 2013. And she had what's called a myomectomy, which is not a hysterectomy. It's a surgical option for women that are interested in fertility. So they cut out some of the fibroids, and that's one of the big problems with myomectomy, is they cut out some of the bigger ones, but they know they leave behind a whole host of smaller ones. So now it's 2026, and she's struggling with symptoms again because the fibroids that they left behind in 2013 have now grown up, and she's got symptoms again, and she's been very brave about her telling her story and explaining, this. And she was upset that her doctors now are giving her the option of doing another myomectomy, which would set her up for procedure number 3. In my opinion, there's never, ever, ever a reason to do more than one myomectomy. You can try it, but for most women, like Lupita, those smaller fibroids are going to grow up and then you're going to recur with symptoms. So instead, you should do UFE, the non-surgical outpatient procedure that we do. If she would have done it in 2013, likely she would be doing just fine now. So, because the UFE procedure knocks out all the fibroids, not some of them. It's also non-surgical, a 30-minute outpatient procedure, and it doesn't risk hysterectomy. Every myomectomy patient has to sign a medical release saying they understand we're going in to do a myomectomy, but you could wake up with a hysterectomy, and that happens. So that's pretty devastating. So the UFE procedure should be told to everybody, but anyone that's ever had a myomectomy, when they recur, they should all know about UFE. But I've seen lots of women with 2, 3, even 5 myomectomies. It's criminal. It should stop. But that's why the awareness, even Lupita, doesn't seem like she's aware of UFE, because she could have had it in 2013. They didn't tell her. Now it's 2026. Not sure she knows about it now either. So hopefully she'll find out about UFE, and instead of getting another myomectomy, decide to get a global therapy, because she said she, according to her, has 50 fibroids in her uterus, which is a lot. And there's no surgeon on the planet that can remove all 50 and still leave you with an intact uterus.
I'm sure, because you mentioned several different symptoms, so I'm sure there are women who have those symptoms and don't even know that they have fibroids. Yep. So if anyone is listening, like, wait a minute, I have some of those symptoms, what should they do to get checked out to see if they have fibroids?
Well, they should talk to their gynecologist or a primary care physician internist, family physician. Some family physicians do routine GYN work. So go to your doctor, tell them about your symptoms. I mean, you're the CEO of your own body. Nobody knows your body better than you. And if something's not right with your body, that's when you go to the doctor. In this particular instance, if you're concerned you might have fibroids, see a doctor about it, talk to them about your symptoms. Now they'll listen to your symptoms and record those. They'll also examine you. And again, as I mentioned earlier, you can feel fibroids on a physical exam. It will enlarge your uterus, often like a pregnant woman. And these rock-like fibroids can be palpated both on the vaginal exam as well as externally on it's called a bimanual exam, using both hands, one inside, one outside. And you can feel these because, you're soft and squishy. The fibroid is hard as rock, so it's easy to determine, oh, your uterus is enlarged. I can feel some fibroids. Let's confirm that with an ultrasound. That's usually the next step. Every gynecologist that I know has an ultrasound in their office. So they'll go, okay, let's go next door and confirm that with an ultrasound exam. Once confirmed, now we know we have the diagnosis. It fits with your symptoms. The next step is treatment. What are the options? Well, no symptoms, no treatment. They're going to the doctor because of their symptoms. So now we're moving into the first stage of treatment options is usually something hormonal, either birth control pills or a progestin-containing IUD. And that usually works pretty well, not great, but usually can hold the line, if you will, for a while. But the problem is we don't know where fibroids come from. That's a whole nother topic we could talk about, the disparity in research for fibroids. We should know where fibroids come from. It's been around a long time and it has a significant impact to society, but we don't know where they come from. But once they arrive on the scene, they grow with estrogen. What's in birth control? What are in these progestin-containing IUDs? Hormones. So they add extra estrogen and makes fibroids grow more rapidly than they otherwise would. So the birth control can lighten flow, because let's say the woman has, doc, I have heavy periods, I need relief, and they feel fibroids causing these heavy periods. Birth control will lighten your flow, but in the background, it's stimulating the fibroids that are there to grow faster than they otherwise would. So it works for a little while, but then it stops working. And then the patient will return saying, yeah, it worked for 6 months, but now my periods are heavy again. And they go, okay, well, we tried the medical therapy, now let's do surgery. And it becomes a binary decision. Either they'll ask the woman, are you interested in fertility? If you say yes, then you get offered, like Lipita, a myomectomy. If you say no, you get offered hysterectomy, like Cynthia Bailey, who was a patient of mine. And so it's either myomectomy or hysterectomy. Well, they fail to mention this other option, which is fantastic, this UFE, uterine fibroid embolization that we do. As I mentioned, it's non-surgical, it's outpatient, 30-minute procedure, several hours of recovery. You're literally going home the same day with a Band-Aid and keep all your parts. And it knocks out, or should knock out, every fibroid that you have in the uterus. It's covered by all insurances, that's not an issue. It's well proven safe and effective with 30 years of research behind it. And you can even have children after. We've had numerous children born after UFE, even twin births. So it should be mentioned to everybody. All women are entitled to know all their options, but if they go to their gynecologist, they're only being told the surgical choices. And that's why it's so important to get the word out. Get that second opinion. See an interventional radiologist. I'm a different type of medical doctor. I'm not a gynecologist. I'm an interventional radiologist. They're the physicians that do this UFE procedure.
So how can the viewers, visit your website, learn more, book a call, and all of those things?
Well, they can. It's easy to find me, fortunately, with the internet. Our website is atlii.com. ATLII, it stands for Atlanta Interventional Institute, which is the parent company for the Atlanta Fibroid Center, atlii.com. We have a Instagram page, dr_ my last name, so it's dr_LIPMAN. We have a YouTube channel, Atlanta Fibroid Center, so that if they go on YouTube to Atlanta Fibroid Center, they can actually watch me do a UFE procedure, start to finish. It's about 35 minutes because I'm talking as I'm doing each step, but it's a very simple procedure, and it's easy to watch because it's not surgical. The approach, as I mentioned, is at the very top of the right leg, where your leg meets your torso. We enter, there's a uterine artery on each side, and each of the uterine arteries is like a big tree. I steer a little tiny catheter, like a piece of spaghetti, into each of the uterine arteries one at a time, and each of those, I'm in the trunk of the uterine artery with the little tiny catheter. Then it starts to branch like a tree, getting smaller and smaller and smaller branches. The fibroids are like the leaves of the tree. I'm in the main trunk, and I can flow direct these tiny particles to plug up all the fibroid branches. The big branches, the main trunk and the big branches of the uterus stay open. I'm targeting the small peripheral fibroid branches. So the uterus stays alive, and as I mentioned, we've had numerous children after, but all the fibroids die. As they die, they soften and shrink, and as the softening and shrinking of the fibroids goes on, the woman's symptoms go away. So she gets the relief, she avoids surgery, keeps all her parts, maybe even have children after.
Wow, that's amazing. And I know, there are tons of myths out there about fibroids.
Lots.
Is diet contributed to them growing at all?
It can, and so that's why it's really important as part of kind of the holistic approach. Patients will always ask me, well, I know you're going to take care of these fibroids, doc, but what can I do going forward? Because I'm young. Maybe somebody's in their 30s. They have a 20-year time horizon until menopause, maybe. They could grow new fibroids over that time. I've knocked out all the fibroids they have now, but what can I do? There are several things. As I mentioned, we don't know where fibroids come from, but we know they grow with estrogen. Estrogen is pervasive. It's in the food, it's in the water. So you can't avoid estrogen, but you can kind of try to limit it as best you can. There are certain hormone-rich foods, red meat, non-organic chicken, dairy. If you can limit or eliminate those or do workarounds, that will help. There are certain foods that have flavonoids in them. Colored fruits and vegetables have these compounds called flavonoids, which block an important enzyme in estrogen production. So if you can eat more colored fruits and vegetables, limit hormone-rich foods, that will help. Estrogen is stored and produced in body fat. It's one of the reasons why African American women disproportionately suffer over other racial groups. In general, they have more body fat. And so if you can lose excess body fat, try to be as close to everybody knows what their ideal weight number is. You don't have to be skinny, but everybody knows what their ideal number is. As best you can, try to get as close to that ideal number through healthier eating choices, exercise, and weight loss. And that will really help your fibroid symptoms. And then lastly, vitamin D is really important. Vitamin D is the most powerful growth inhibitor of fibroids that we know of. Only 10% of African American men or women have adequate vitamin D, because if you did, it is likely you won't suffer with fibroids. It's that powerful. So I tell all of our patients, get your vitamin D level checked, and if you need to be supplemented, supplement it. The darker the pigment of one's skin, the harder it is to get adequate vitamin D. So some people, and I have low vitamin D, I'm in the office too much, I don't get enough sunlight apparently. So I take vitamin D every day, but sometimes it's only 1,000 or 2,000 or 5,000 you can take over the counter. Sometimes you need a prescription, 50,000 or more. So have your doctor check your level and follow it and make sure that you stay normal, because if you can stay normal, it will definitely help your fibroid situation. And then there's the genetic aspect. It runs stronger in African American families. You can't pick your parents, at least not currently. So there are certain things you can't control, but of the things you can control, if you are really diligent about it, it will definitely help your fibroid symptoms.
Gotcha. Those are some great tips. And if you're watching, I encourage you to send this video to at least 5 of your friends. If you don't feel comfortable asking them if they have fibroids or asking them about their health, just share this video with them so that they can learn what they need to know to, deal with it in a way that doesn't force them to have a hysterectomy. That is a huge surgery for a woman, and if there's any way that we could save our friends or our family or our cousins, our aunts from having to have that, I think we should do our part by simply sharing this video out. Dr. Lipman, thank you so much for taking the time.
My pleasure. I really appreciate it, because that's part of the problem is we don't communicate enough. There's a certain period shame with the periods. They think they're the only ones going through this, and so they don't want to talk about it, or it's an embarrassing topic. Women have to communicate with each other, mother-daughter particularly, but also sisters, aunties together. You've got to spread this information. You got to get over this, I hear it all the time. Well, we just don't talk about periods in our family. Well, you need to. And that's why it's really important when men come to, I speak all over the country on fibroids and periods, and I'm happy to see men in the audience because men got to know about this. I know they don't know much about periods, but they have women in their life, and it's really important to communicate so they can understand what women are going through. There is a lot of suffering going on in silence, whether it's shame, whether it's we don't want to bring this up. And if men understood the suffering that women go through, I mean, even though I'm a physician and I have 3 kids, my wife was responsible for the health care. And when mom wasn't feeling well, the whole family suffered because women, you're nurturers, you take on, you should be more selfish. I tell this a lot when I talk to women. I say, when you're on the airline, what do they tell you to do? Put your mask on first. But as women, you don't. You're nurturers. You'll suffer through, you'll push through, you'll do everything for everybody else and not take care of yourself. I'm asking you, take care of yourself. It does affect everyone in the family, and have those difficult conversations. It's so important to know about your period, and if anything feels off, bring it to your doctor. And if your doctor dismisses you, that's another issue that a lot of doctors ignore, or they don't have the time to delve into the stuff, and you feel dismissed or ignored. Find another doctor. There are plenty of good doctors, particularly here in Atlanta, but elsewhere. If you're not feeling like you're being heard or listened to, find another doctor. There's plenty of good doctors here, and trust your instinct and get that second opinion. There's no reason, no matter what, I guess this is the most important thing I'll tell everyone. The most important thing is no matter what your gynecologist tells you, you do not have to have a hysterectomy for fibroids. Fibroids are benign tumors. It's an option, but it's, in my opinion, it should be the option of absolute last resort. Because UFE, uterine fibroid embolization, is so good, likely you won't need a hysterectomy or want it ever. It'll take care of it completely without any surgery, and you'll get to keep all your parts, maybe even have children.
I love that. I love that. I love that there's a solution to help us continue thriving in our health and wellness. I'm going to put Dr. Lipman's links in the bottom of this video so that you can just click and go straight to his website, Instagram, and YouTube channel. Again, I urge you to share this video with your friends, your cousins, your aunts, and just let them watch and let them, discover this as an alternative if they are suffering in silence. Thanks again for tuning in to another episode of Glambish.